and greetings from Uma Eye Clinic, Chennai. I am Dr. Aditya Varman. I am a cataract, cornea and refractive surgeon. In this video, we are going to discuss about the various modalities of laser refractive surgery and which modality would be the best treatment option as of 2023. So this is going to be a long video. In case there are certain questions that you want to be addressed, and that's the part in which you are interested in, I encourage you to look at the timestamp in the video description and skip to the relevant part of the video. So before we move on to the various modalities of laser refractive correction, one must first understand why certain people have to wear glasses for them to be able to see clearly. You must first understand how the eye works and some basic physics about the eye. So we can treat the eye like a camera, like how a camera has various lenses in the front, which allows the images to be focused so that the camera can take the pictures. The eye is also just like a camera, where there are very important focusing mechanisms by nature. The front part of the eye is called the cornea. It's a transparent structure which has a certain curvature and a certain thickness. This is very important to focus the light rays coming from outside. Behind the cornea we have a lens, which also is important in focusing. And finally, the focused image must fall directly on the macula of the retina for the image to be formed clearly. So what we must understand that the eyeball is supposed to be of a certain length. Usually the length is about 24 millimeters. By nature, just like how some people are taller or how some people are shorter, the length of the eyeball can also vary. If the eyeball is longer by 1 millimeter, let's say it's 25 millimeters or so, or 25.5 millimeters, that person will have a power of -3. Similarly, if the eyeball is a little shorter than usual, if it's shorter by 1 millimeter, that patient will have a power of +3, and they'll have to wear glasses or contact lenses for them to see clearly. So this is the basic mechanism by which a refractive error is first present in a patient and how it is corrected. So the second question is, how do we treat such refractive errors via lasers? Like I said in my previous explanation, laser refractive surgery works by the modality of changing the shape of a cornea. The cornea shape is changed by removing a certain amount of tissue from the cornea. The cornea is about 525 microns thick. Laser refractive correction works by reshaping the cornea to a new shape such that this newly shaped cornea will now be able to focus the light rays well without the need of glasses or contact lenses. How much of the reshaping of cornea or how much tissue we remove from the cornea is dependent upon the person's refractive error or glass power. So if a person has an error of, let's say, -1 or -2, the amount of tissue removed will be a little, whereas if a patient has a power up to -7, -8 or even -9, we have to remove a greater amount of tissue. So this comes to the next question. Who are all eligible candidates for laser refractive correction? So there are a few criteria to be met before we deem a candidate eligible for laser refractive surgery. So why do we have these two criteria? The answer is very simple. Because up to the age of 18, a person's glass power can keep changing. So around the age of 18, when the body stops growing, is when the glass power stabilizes. So we don't want the power to change after the laser surgery is done. That's why we keep a minimum age limit as 18. So even if a patient is 18 and let's say they are about 19, 20 or so, but if we still see a change in the glass power between the last 1 year of examinations, we would still suggest that the patient wait a few more months before we confirm the eligibility for laser refractive surgery. Other criteria are to do with the shape of the cornea, the corneal thickness and the corneal topography examination. So because laser refractive surgery works on the basis of changing the shape of the cornea, one must undergo a thorough corneal examination, including a scan known as corneal topography, which looks at the shape of the cornea, the thickness, the curvature, etc., to see if the corneal curvature and shape and thickness are all within normal limits. If they are not within normal limits, such a patient will not be fit for laser refractive correction because it will predispose them to future complications. For such patients, we reserve another treatment called as ICL, which I will elaborate on further down this video. So third question. So what are the different modalities of laser vision correction available in 2023, and which modality would be the best option? So you must have heard about PRK, Lasik, Contoura, Smile, etc. So let's start from the beginning. We'll first start with PRK. So PRK was one of the earliest laser refractive surgeries which was introduced. Very popular in the 90s. So how this works is, it works with the basis of a laser called the excimer laser. So what we do in PRK is, we would remove the epithelium of the cornea. The cornea has various layers. The epithelium is the most superficial layer of the cornea. It's like your skin basically. That epithelium layer is removed mechanically, following which the excimer laser is applied directly on the bed of the cornea, and the excimer laser will reshape the cornea by ablating some tissue. This is how PRK works. It's actually a very successful procedure, works very well, but there are some reasons why we don't perform it as commonly today. So a few disadvantages of PRK was, one, the recovery time was longer. Because we remove the epithelium of the cornea, for it to grow back takes about 3 to 5 days or so, during which time the patient will feel quite uncomfortable. They will have a lot of burning, redness, irritation, etc. And the vision will not be as clear for the first week or so. So this is something they'll have to put up with. They won't be able to step out of their house out into the outdoors and sunlight, because it will be very irritating for them in this first few days after the PRK treatment. Another issue with PRK was, there was instances of haze formation in the cornea, which means the cornea can still remain hazy after the PRK laser, and this can disturb the vision. Third complication was, powers tend to recur in PRK. Basically, let's say a patient was treated for -4 or -5 with PRK. In the future, after the healing period is over, there could be a chance of a 0.5 or 0.75 power recurring again to the patient, for which they might have to be treated again. So for these reasons, we don't prefer PRK as a first line treatment for a patient for laser refractive correction. But it still has its place today in certain very select situations where PRK will be a good option. And if you are considering PRK as the option for your laser refractive correction, please do keep these points in mind. Second, we move on to Lasik. So Lasik works by creating a flap on the cornea. So basically how this flap is created is by using a blade or a femtosecond laser. So what we do in Lasik is, we create a 24mm partial thickness cut on the cornea. This cut is not full thickness, it's partial thickness. So out of the 500 microns thickness of the cornea, the flap is usually about 100 to 120 microns. So this flap runs about 24mm on the cornea and leaves a portion of the cornea uncut, which serves as a hinge for the flap. This flap, after being created, is raised up to expose the bed of the cornea. Then the same excimer laser only is applied to reshape the cornea by removing some tissue. After the tissue is removed, the flap is repositioned and the patient will experience clear vision from the next day. Lasik is actually a very successful procedure, one of the most commonly performed procedures today for laser vision correction. So patients can expect to have clear vision within 24 hours or so, following which the comfort is also quite good. Most patients are quite comfortable to resume activities within a day or two. But Lasik also does suffer from some disadvantages. So the first disadvantage is, one, because of the large cut on the cornea, the nerves on the cornea are also damaged, which leads to a sensation of dryness or irritation after the procedure, which can last for many months. The other disadvantage is the process of creating a flap. This process of flap creation relieves a flap on the cornea for the patient forever. This flap never truly fully heals, because of which any minor grazing trauma that happens to the eye can dislocate the flap, which can lead to future complications and disturbance in the vision. So the other disadvantage happens to be with the physics of the excimer laser directly. If we look at how the excimer laser works, the excimer laser is delivered via mirrors. So because it is delivered via mirrors, the excimer laser will travel via straight lines. It cannot travel exactly in a curved manner. But if you look at the cornea is a prolate surface, which means the cornea is curved. So when we treat a patient with high powers with the excimer laser, the results are not as good, because when treating with the excimer, the higher powers we treat, the larger is the treatment zone of the cornea. So in higher powers, we have to treat the cornea in the more peripheral zones. In such cases, the excimer laser will not reach those peripheral zones very well, because the cornea is curved and the excimer laser can only move via straight lines. So treatment for higher powers is actually not very accurate and might not give good results for patients with higher powers such as -8, -9, etc. So we now move on to the customized Lasik treatments, which go by many brand names. You might have heard of Contoura, you might have heard of Vizix, etc. All of these are just brand names which are marketed by different companies, but the way that they work are all more or less exactly the same. So because of this basic flaw in the excimer laser in treating higher powers, this customized Lasik or Contoura or Vizix works by trying to compensate for this flaw by mapping the cornea with corneal topography and treating those peripheral areas more evenly, such that the even treatment zone is acquired. So this gives rise to better results when compared to Lasik, but still the basic flaw of excimer laser cannot be completely overcome. So now we move on to the another method of laser refractive correction known as SMILE. So what exactly is different in SMILE? We still do the same corneal reshaping by removing the tissue, but in SMILE we only purely use the femtosecond laser. So what we do in SMILE exactly is, the femtosecond laser is a laser that is delivered via an instrument which directly touches the cornea. Because it directly touches the cornea to apply the laser which is delivered via fiber optics is able to treat the cornea in a more even manner, such that a very even treatment zone is acquired. So whatever the power, be it -1, -2 or -3 or even up to -10, the treatment zone size remains exactly the same. In SMILE, the femtosecond laser doesn't require a large flap to be created. So the laser is able to penetrate the corneal tissue without the need of creating a cut on the surface. And it reshapes the corneal tissue without making a large cut, and finally only makes a 2 mm incision via which the corneal tissue to be removed can be extracted via forceps. So SMILE does offer a lot of advantages to the patient. One, the treatment zone is very even, so even when treating higher powers, there is no cosine effect that we see in Lasik or Contoura or Vizix. So the results are very good even when treating high powers like -9 or -10. The second advantage is there is no flap created. So since there is no flap created, the patients have a less restrictive lifestyle after SMILE. Even when rubbing the eye vigorously or any minor grazing trauma after the procedure, there is no chance of any visual complication from happening. Third advantage is because the incision in SMILE is only 2 mm, the nerves in the cornea are not damaged as much, so the chances of dry eye occurring after SMILE are much lesser. And the other advantage of SMILE is that because there is no flap created, there are studies to support that the biomechanical strength of the cornea is greater when compared to Lasik where there is a flap created, such that the future chances of a complication of laser ectasia happening are very, very low. So these are the advantages of it. And in 2023, there is a newer development in SMILE known as SMILE Pro. So there was some doubt cast on SMILE being able to correct cylindrical errors, but SMILE Pro has now addressed that, in that it does provide cyclotorsion compensation, such that even high cylinder errors are quite accurately treated with this SMILE procedure. So as of 2023, it does seem that when treating patients with the error which is correctable via laser, SMILE does offer more advantages over the other older methods of refractive correction. We now move on to the next question. what if patients have a higher power? Let's say they have a power of -10 and above, or they have a thin cornea, or they have a corneal shape which is not amenable to laser refractive surgery. For these patients, we reserve a treatment called as ICL or phakic IOL. So just like how some patients prefer to use contact lenses that go over the eye, the ICL or a phakic IOL can be thought of as like a permanent contact lens. So this is quite a sophisticated technology in which we look at the patient's eye measurements very accurately. We measure the length of the eye, the other dimensions of the eye parameters such as the anterior chamber depth, white to white, etc. We look at the power and we create this phakic IOL or ICL lens for them specially. So basically that means every patient has this specialized lens which is created from scratch to fit the eye very perfectly. So this whole process of manufacturing this ICL lens itself takes about 2 to 3 weeks for the company to manufacture from ground up. So what is the difference in the treatment? So in laser methods of refractive correction, we usually perform both eyes on the same day, whereas in ICL we don't do both eyes on the same day because it is a more invasive procedure. So we do them one day apart. So how the ICL works is, after the lens is manufactured and the patient is ready for the treatment, we implant this lens surgically such that it sits behind the cornea but just in front of the human lens. So this acts like a permanent contact lens which will fit the eye well and will not really move around much at all. So it can be thought of as a permanent contact lens that once implanted need not ever be removed at all in the future. The results are quite good. Any amount of power can be treated via ICL. So you can treat even -1 right up to -10 or even -20 and beyond. So you might be asking the next question now, why aren't all patients offered ICL if it is so good? Why do you have it as a secondary treatment option only if they are not fit for laser? Well, this is to follow basic medical protocol. As surgeons and doctors, we always prefer to perform the less invasive procedure for the patient. So anything that can be performed in the outer part of the body is always preferred first over an invasive procedure. So because the laser refractive surgery works by treating the outer part of the eye on the cornea, we prefer that over a more invasive procedure such as ICL. But this does not mean that ICL is not safe or that is an inferior procedure compared to laser. It is also a very good procedure which has been around now for many years, and there are a lot of studies to prove its efficacy and safety. So what we have to understand, if you have this one takeaway from this whole video, is that there is no one size fits all when it comes to laser refractive correction for treating your glass power. After all the appropriate examinations and scans and tests have been done, please do talk to your ophthalmologist and listen to their opinion on which surgery would be the safest and best for your eye and your long-term safety and efficacy. I hope this video has been informative to you. If you have any further questions, please do drop them in the comment box below. Thank you for your attention.